Let's talk about Takayasu arteritis, also known as pulseless disease. So, Takayasu arteritis is a large vessel vasculitis. So, large vessel vasculitis, there are usually it is Takayasu arteritis T and temporal arteritis, right, which is also known as giant cell arteritis. So, Takayasu arteritis is more common in women in their reproductive age group, that is 15 to 45 years. It is named after a Japanese ophthalmologist that described his first ocular manifestation in the year 1908. The most common sites are aorta and the left subclavian arteries. So this is a very important slide. Coming to the diagnostic criteria for Takayasu's arteritis, according to the American College of Rheumatology, 3 out of 6 is 91% sensitive and 98% specific for the diagnosis of Takayasu arteritis. The age of onset is usually less than 40 years. Limb claudication should be present, decreased brachial artery pulse, unequal arm blood pressure, the difference of more than 10 millimeters of mercury, subclavian or aortic bruit, angiographic evidence of narrowing or occlusion of aorta or its primary branches, and large limb arteries. The clinical features of Takayasu arteritis, if you understand the diagnostic criteria, writing the clinical features is very easy. Bruit will be present, claudication, hypertension, and lightheadedness. Aortic regurgitation is present in around 30% of the cases. Absence of pulse in the upper limbs. Bruit, it is most frequently heard over carotid arteries, but may also develop in supraclavicular and infraclavicular areas. Bruit may be present in the abdomen in case of renal bruit and mesenteric artery vasculitis. So there can be widened pulse pressure and diastolic murmur along the right sternal border, as 30% of the people, as I described in previous slide, have aortic regurgitation. There might be hypertension. Patients will present with congestive cardiac failure, angina, and aortic regurgitation are the cardiac symptoms present in case of patients of Takayasu arteritis. Around 50% of patients develop constitutional and musculoskeletal symptoms like asthenia, weight loss, fever, myalgia, and arthralgia, which occur commonly. The investigations which we do in case of Takayasu arteritis is the inflammatory markers will be elevated, like elevated ESR and C-reactive protein. Anemia and thrombocytopenia will be present. Vascular abnormalities can be imaged by conventional angiography, MR angiography, or CT angiography. The treatment of Takayasu arteritis is high-dose glucocorticoids with steroid-sparing agents like methotrexate and leflunomide, vascular interventions for treatment of stenosed arteries leading to organ ischemia or hypertension or aneurysmal disease.